Hello, everyone, and welcome to the Dr. R Show. We'll be coming to your living rooms weekly to discuss various health topics with the help of medical experts in their respective fields. Meet my two very special assistants, Megan and Christina.
And I am so excited because today is leg day.
And then inhale as you lower back down.
They will be with me every week to give us tips on healthy eating and proper exercise.
Stretch and keep yourself hydrated.
So welcome to my show as we both learn together. Welcome to Dr. R. On today's show, we're going to be talking about chiropractic. And with us today is Dr. George BOBBIT, a chiropractor from MANSFIELD Chiropractic. Dr. BOBBIT, what is chiropractic?
Chiropractic is simply a form, a healthcare method that helps people get well, say naturally, without drugs or surgery. Simply, chiropractors focus on problems of the spine, maybe the muscles, the bones, and then conditions that result from that. So we really work with the nervous system, the muscles, and the bones. That's what chiropractors do.
And how long have you been doing it?
I've been doing chiropractic for at least 15 years and hope to do it for a long, long time.
And where did you go to school?
I went to a school called Texas Chiropractic College just in the Houston area.
So to become a chiropractor, is that something you go to after high school, or do you need a bachelor's degree before you enter chiropractic school? How does one become a chiropractor?
Traditionally, most people that become chiropractors, they do a 4-year bachelor degree, and then after that 4 years of college, they do another 4 years of chiropractic school. And then once that's over, then we're able to start practice.
And so chiropractic has been around since roughly the 1900s. And how has it changed over that period of time? Have there been different treatment methods that have developed over that period?
There sure have. As we started out, there was one official chiropractic school in the early 1900s. And now in the United States, there's over 17. But in the other countries, there's already 24. And we went from being just an isolated group to now being integrated in our hospitals. We have chiropractors in VA centers and even in cancer centers. So we're being utilized for our skills and knowledge across the country.
And how does chiropractic differ from osteopathic medicine?
One of the most interesting things is in the early days of when chiropractic was being formed, there was another science, there was another medical science called osteopathy. And simply there was two forms of thought. One was that the nervous system was the cause of disease, and the other one was that the blood, problems with the blood was the cause of disease. And so the main difference over the years between chiropractic and osteopathy is simply how we treat. So now chiropractors treat mostly naturally without drugs or surgery and utilize a lot of different methods, whereas osteopathy utilizes medicines and surgeries as well. So they're very much medical doctors and osteopaths are the same, where chiropractors are not utilizing those tools.
So do osteopaths do the same type of spine manipulations that chiropractors do, or is there a difference?
That's a good question. There is a difference, and the difference has to do with, in my opinion, is this is what we do all day long. Our main form of treatment is chiropractic adjustments or spine manipulations. Whereas with the osteopaths, they're not doing it as frequent as they used to. It used to be a common practice, but not now. They're not doing it as much.
And in terms of the treatment protocols, how many different protocols are there? Are there different sub-segments of chiropractic?
There's a lot of different versions. There's a lot of different styles of treatment because you have to be able to adapt for all ages. So whether there be children or elderly, different techniques work for different people. So I would say that there's at least 20 different styles of techniques plus an integration of all the things that we learn over the years. There's instrument techniques, there's manual forms of manipulation, there's even soft tissue work that we do. So we have to find a way to treat every person any way we can to give them help.
And what's the theory behind chiropractic? What's the science? What's it based on?
This is one of my favorite analogies. I like the breaker box analogy, where in our house we have a breaker panel, and every one of those switches controls a certain part of the house. Where our body has the same thing, where every bone in our spine, there's a nerve that comes out, and that nerve goes to a different place. Some of the nerves go to your legs, and some go to your arms, and some go to some of your organs. So the theory is that if the spine is out of alignment, it could create pressure on a nerve. And if that pressure on a nerve went to the muscle, it could make the muscle not work. Or if that nerve pressure went to an organ, it could make the organ not work like it should be. So overall, the idea is if we could take the pressure off a nerve and realign the spine, then we could essentially help them with a condition that they have.
How does the spine get out of alignment?
Most of the time, it's due to some form of repetitive stress or trauma, most commonly fender benders or slips or falls, or just everyday repetitive work. Nowadays with the sitting computers and having mobile devices that we're always looking, we're creating this repetition movement patterns. So most of the time it's going to be some form of trauma, whether minor and all the way up to big deals like car accidents.
And how much research is being done in chiropractic right now?
There's a tremendous amount of research, especially on the cutting edge of what's happening to a body before we treat, what's happening after we treat. So now with MRIs have the capability of giving us that. We're really interested in the disc problems. We're really interested in how do we help prevent people from having to go to surgery if we can, or how do we help people after surgery with that. So most of the research right now is just trying to validate that that the science that we do and the work that we do is there to really help people, and it's here to stay.
And so what's typical, what kind of conditions does a chiropractor treat?
The most common, simply back pain, neck pain, and then certain types of headaches. And that's where right now most of the population utilizes this for. But there's so much more to chiropractic, because when we talk about all the conditions of the muscles, the bones, the nervous system, there's a lot. Sciatic conditions people are familiar with, tendinitis, that's another common form. And then you name it, as far as if it involves the body and the components of the muscles and the spine, we can help. There's too many to mention, but that's what we're mostly known for: back, neck, headaches, and then the extremities, knees, hips, elbows, the list goes on.
So you're mentioning mostly musculoskeletal type problems. What about treatment of asthma, ear infections, things like that? I've heard that some chiropractors treat those sorts of things.
If we go back to the thought process, is we're primarily specialists in the musculoskeletal system. And if the spine is out of alignment and it does put pressure on a nerve, and that nerve went to the lungs, then somebody could develop an asthmatic condition. We don't necessarily treat asthma, but if asthma was a result of pressure on a nerve or a spine being out of alignment, then there's a possibility that we're able to help that condition, help the body heal itself.
So the vast majority of things that you deal with more musculoskeletal.
Yes, that's really where we're really talented, and that's our niche.
Anyway, we're going to have to take a quick commercial break, and we'll be right back.